Lung cancer is the second most common cancer in both men and women in the U.S. and is by far the leading cause of cancer deaths in the U.S., accounting for about 1 in 5 of all cancer deaths.
And this is especially the case when treatments such as chemotherapy and radiation fail. Dr. Frank McGeorge is here with a new option being studied, and we're talking about a lung transplant here, Doc.
Yeah, Kim and Karen, and in fact, we are actually talking about transplanting both lungs at the same time. And on top of that, it's in people with advanced lung cancer that has already spread widely within the lungs. This level of spread is generally fatal, but in the right circumstances, transplanting both lungs at once can remove all of the cancer and return a person to their lives again.
Amazing. I'm so happy I'm alive.
It's hard for Al Corey and Tanaz Ameli to imagine themselves sitting here today.
Every day I wake up and I go like, I'm cancer free.
Al is a cement worker for the city of Chicago and worked out 3 hours a day. But in 2020, he was diagnosed with stage 4 lung cancer. Doctors said he was just days away from death. But just in time, his sister saw a story about Northwestern completing a double lung transplant to save a patient. That person didn't have cancer. They had COVID, but Al begged his doctor to do the same surgery on him. Traditionally, lungs are replaced one at a time, but with advanced stage lung cancer, patients need both done in one procedure.
So that we don't spill even a single cancer cell into the bloodstream or the chest cavity. We feel quite confident that this new approach of doing the transplant will allow us to accomplish those goals.
In September of 2021, Albert became the first person with stage 4 cancer to get a double lung transplant. Tanaz Ameli was in Minneapolis, and she was told to get her affairs in order when her husband saw a story about Al's procedure. And in July of 2022, Tanaz was the second person treated. The two have now formed an unbreakable bond, along with the doctors who allowed them to breathe easy, knowing they're both now cancer-free.
They're my heroes.
Every day that we wake up, we're thankful for it.
Now, I really want to emphasize, this is not standard therapy. In fact, Northwestern Medicine essentially considers this an ongoing observational study with the goal of enrolling 75 patients over the next 10 years. And also, because double lung transplantation has only been done or hasn't been done, I should say, in a significant number of advanced lung cancer patients at this point, we actually do not know how successful it's going to be long term.
Now, the people in your story, though, they had stage 4 cancer. I thought when you have stage 4, that means it's already spread. That's not the case?
No, that is actually exactly what it means, and that's an important point here. They're only doing this basically in lung cancer stage 4 patients where the only spread is to the other lung. If it has spread to any area outside of the lungs, then they are no longer considered a candidate for this double lung transplant.
It still seems like a miracle, right?
It absolutely is. I mean, the idea of basically being able to transplant both of someone's lungs to get rid of the cancer is really remarkable.
Crazy.
Incredible.
Yes.
Thanks, Doc.